My name is Doug Bremner. I'm a doctor and a writer and live in Atlanta, Georgia. There's some pretty chilling pieces of information about prescription medications. Do you know that over half of Americans are on some kind of prescription medication, and that 82% of people take some kind of pill, including a prescription medication, a vitamin or a supplement? And many times those even vitamins and supplements that people think are natural and healthy, they can have dangerous side effects as well. A lot of people don't know it, but people who take high doses of vitamin A through supplements have a double a risk of fracturing their hip. That's for elderly women. And that the country of Denmark has actually banned Kellogg's fortified cereals because they think there's too much vitamin A in it, and they're concerned about the effect that it could have on women. Did you know that 100,000 people each year die from the complication of a prescription medication?
Sorry.
She said she didn't want to be in the film, but I guess she is anyway. Did you know that a quarter of Americans are obese, and that translates into increased risk for a number of conditions, including heart disease and diabetes? Do you know that making changes in your diet and lifestyle actually has been shown to work better, both for treatment of heart disease in people who had a heart attack and in the prevention of diabetes for people who are at risk of diabetes? Did you know that fish oil has never been shown to prevent a heart attack? It's just been shown to reduce risk of recurring heart attacks in people who've already had a heart attack. It can also give you a fishy smelling breath. And what about osteoporosis drugs like Fosamax? Do they actually work? I mean, do you need to get your bones checked to see if you have bone thinning? Well, as I've written about before in this book, before you take that pill, why the drug industry may be bad for your health. The kinds of osteoporotic fractures that matter are hip fractures, because that can cause lasting disability. And in women who don't have a history of osteoporotic fracture, they have not been shown to reduce the risk of hip fracture. And after about 5 years, they stop working. They don't prevent osteoporotic fracture anymore. And in fact, after 5 years, they can make your bones more brittle, so that if you do have a fracture, it'll take longer for it to heal. And it's been shown in animal studies that actually these drugs actually decrease the bone turnover, and that can eventually become a problem. Did you know that it's never been shown that statin drugs like Lipitor and Crestor prevent heart attacks in women without a history of heart disease? I mean, I don't read about that in the paper. I mean, you hear about how heart disease is extremely common in women, or more common than we previously thought. And the implication is that you should go to a doctor to get your cholesterol checked and possibly take a medication for that. But why would you want to spend a couple $1,000s a year on a medication that could possibly cause liver damage, and in as many as 5% of people that develop muscle pain that's actually caused by damage to the muscle fibers? Why would you want to do that and have to remember to take a pill every morning if it's never been shown to work for you? I mean, I sure as heck don't. There's many other examples of these types of prescription medications and vitamins and supplements that may cause dangerous side effects, and you don't want to wait until it happens to you or to someone in your family. You should really educate yourself first. So I have a website at www.beforeyoutakeThatPill.com, and there's also dougbremner.com. That's BREMNER. So you can go check out my websites, and I have lots of information about all kinds of conditions on the website, and you can read more about the book. And I also write a blog, which I look at drug news and healthcare topics, but try and have a little bit of sense of humor involved there too. Okay, so here's your health.